But for some people that maybe they can't use their eyes or they can't move their head, but they can still focus their mind, they could reduce it down to just the BCI. So the intended design of this was inspired by Stephen Hawking and people with ALS that have a progressive condition. And so the idea here is that you could start at the early part of the disease and say, while you still have head motion, but you might have trouble walking or moving your arms, you could get this headset and just use head pointing. But then as the disease progresses where you can no longer move your neck, then you could switch over to eye tracking. And then when you have trouble with eye tracking or where it becomes too taxing and tiring, you could flip over to BCI. And so this would extend the usefulness and the accessibility of the world.
We're going through something absolutely historic.
Technologies across the board are growing exponentially.
It's a disruption that's going to completely redefine the way businesses compete.
In the next decade, we're going to lose 40% of today's Fortune 500 companies.
The exponential growth of computing is continuing.
AI is nowhere near its full potential.
Whether you like it or not, that the future cannot be stopped by anyone.
In this episode, my guest and I explore how brain-computer interface, BCI, technology is evolving, and what that could mean for the future of human communication, healthcare, and daily life. We look at how non-invasive BCIs are opening up new ways for people to control devices with their minds, without the need for risky surgeries, and how this technology is already making an impact for individuals living with disabilities and progressive conditions. Our conversation also moves beyond healthcare, discussing how BCIs could change everything from remote diagnostics to human-machine integration in industries like sports, emergency care, and beyond. We touch on how augmented reality and brainwave-driven interfaces might one day redefine how we interact with the digital world, and why the focus on creating a more human, personalized experience with AI and BCI tech is so critical. Looking ahead, we explore how society might change once BCIs become as common as smartphones, and what it means to navigate a future where the boundary between brain, body, and machine is increasingly blurred. Andreas Forsland is founder and CEO of Cognition, an assisted reality company that has created a brain-computer interface integrated with an augmented reality display. The company was previously called SmartStones and developed accessible communication technologies for people with speech disabilities. Cognition has been recognized as one of 21 neurotech startups to watch, won the Red Dot Best of the Best Award for AR/VR, and has been nominated for the Red Dot Luminary Award, the Edison Award, and the Singularity Global Grand Challenge.
Hi there, Andreas. Thanks so much for joining the podcast today to talk about a topic I haven't touched on in the podcast for a little bit, but it's one that I think every episode I do, it kind of blows my mind a little bit more. So it's great to have you on to talk about BCI and the interesting technologies that you guys are building and how this is going to impact the world, change society, and certainly benefit some people, I think, that need it right now. So I'm very much looking forward to getting into it.
Awesome. I'm really glad to be here. I'm happy to tell my story and learn from some of the questions you might have after.
Right on. Well, I start every episode with, asking how you got involved in what you're doing now. Was it, I'll let you answer that, but it's always curious to see how people get brought into the space that they're working on.
Yeah. I would say my whole life, I've always kind of been a creative person, artist, designer, user experience person, branding person. And then I used to work at Philips. So I was at Philips Design, which is like an IDEO innovation kind of company, but within the greater Philips Electronics organization. And so we were tasked with really looking around horizons, thinking sort of looking over the horizon and imagining using anthropological signals and other kinds of loosely defined data. What do we anticipate like multiple futuristic scenarios might be? And then thinking about how you back into this and saying, okay, well, how do you create really provocative concepts to instigate internal dialogue around where the future is going to be? And then how do we actually back into near-term and short-term horizons to say, how do we apply that future thinking into decisions we need to make today, right? Around the next version of a product or creating a new category or creating a new product that is going to have to sort of fight for its life today, right, on the shelf. So I've been really exposed to sort of the near term, midterm, and long term types of scenarios and thinking about the future. And I would sort of accredit a lot of the internal culture at Philips for helping to train me in that. That was a while ago. Uh, but I got into this field of BCI in particular, neuroscience in particular, because of a very near term thing that happened to my mom. My mom, as most of us know, our parents are getting older. And as they get older, they become a bit more vulnerable. And so she was having her 70th birthday, and she lived on the East Coast of the United States. I live in California. And she came to visit, and she wasn't feeling well. And I just figured it was the typical thing you get on the airplane. You're a little bit dried out. But the next day, she was admitted and rushed into the ICU for pneumonia. And so it was very aggressive pneumonia. Uh, she was put on life support. They intubated her, which means they put a whole breathing apparatus down her throat. They had to restrain her arms so that they could sedate her so she didn't take the life support out. So you can imagine just the amount of sort of chaos of going from, hey, mom, to like, are you going to live, mom? Right. And then, period. Um, and so I had to be her bedside communication partner in that situation. And so she couldn't communicate verbally for herself. And she certainly couldn't do things with her own body, her arms. So if her nose, you imagine you're like intubated and you're like, my nose is dried out. It itches. How do you tell someone that? Right. Yeah. Or if your doctor that's making the rounds in the ICU comes by once a day, and you're like, you miss your opportunity to like tell them what's on your mind or what you need. And so it really sunk with me of like how important communication is and how quickly that can go away with really seemingly common conditions. And so because I had experience at Philips with healthcare and consumer electronics and whatnot, um, I really understood how to rapid prototype solutions. And so I had an idea originally of like, imagine there was like a little stone that she could hold in her hand that was basically the guts of a cell phone that was sort of, get rid of the screen and you just have like a touch surface or a gesture recognition kind of thing. And you could connect it to a phone over Bluetooth and program a bunch of text fields that could correlate with gestures. And each of those gestures would say like swipe up would be yes, swipe down would be no. And you'd be able to have a basic independent communications interface that doesn't take a lot to learn. So that was really the original inspiration that came from my mom's situation. But as I dug into it, I realized like, wow, I mean, there are a lot of people that are sort of admitted into hospitals for pneumonia. Exactly. But there's hundreds of millions of people that are living with chronic disabilities that I didn't know about, right? Like I just wasn't even aware. Sure. And so stroke and cerebral palsy and, autism and ALS and, Parkinson's, like all these conditions that impact someone's ability to speak or to be able to move their body. And so that's when I realized that there was a huge business opportunity to figure out, is there an actual technical solution that anyone could use, regardless of their cognitive ability, to do basic things for themselves, whether that's communication or move around? And there wasn't anything, right? There were a bunch of point solutions for certain kinds of things, like rehabilitative tech or iPad apps, things like this, but nothing that could scale across so many people with so many unique needs. And then that's when I realized like there was such a thing as like BCI. We started to and say like, well, what is 500 million people? What do they have in common? Right? There's like 500 billion people that are living with chronic disabilities worldwide. What do they have in common? Well, they all have a brain. They all have a nervous system. The peripheral nervous system is mostly dysfunctional. Right. And so you're kind of working back to like the least common denominator of like, what are the first principles of what you have? And you said, well, even the person that's the most locked in, right? The person who maybe has like traction, they had a brain injury or they had a stroke and they're just not presenting any kind of visible abilities, even to move your eyes. What is the one thing that they might be able to do? Right. And they might be able to think, up or down or left or right. And so that early work with that stone transferred into neural intention detection and saying, well, if someone could just imagine moving something right? As a mental gesture. Could they do the same thing as like swiping up on a stone and controlling an app? And we're like, yes, absolutely, they could. And that was really we sort of switched from kind of a gesture-based interface to a BCI back in 2015, 26. So we were really, but we knew that most people didn't want surgery, and I personally didn't want to run a business. Okay, like I don't like blah. Oh, so I really was just, I have a choice in the matter, and I said I don't want to run a company that's going to be cutting people's heads open. That's not what we do. And it's also a force limiter on scale and impact. And so we really just sort of said, hey, I'm gonna leave my cushy exec job, and I'm gonna just go for it and try and create a wearable platform that can scale to hundreds of millions of people and provide apps that would be helpful to them. Yeah.
Yeah. Yeah. Okay. Well, thanks for that. That's a very kind of elaborate introduction to all of this, which is great. It enables us to go down a number of different paths here. Maybe just one question on kind of the BCI industry as a whole. Also for me, because as I mentioned before, like I'm not an expert on this, but it's certainly one, if not the most fascinating technologies out there today. To me, it seems like most of the BCI technology companies out there are really focused on um, this cohort, this group of people that have disabilities. But there are maybe some companies that are focused on like improving mindfulness or improving your abilities in some way, right? Bringing, I think it's like your REM pathway, like your neural pathways into the waking state, and then it's able to bring you into the flow state a little bit more. I'm probably butchering it, but I think you understand my point here. Is the size of the industry, is that like 1%? Is that 10%? Is that growing? Or is it still 99% focused on people with disabilities?
Got it. Um, well, yeah. So if you think about it, like we're addressing the entire world's population, right? Because everybody's getting older and everybody's senses are diminishing over time, right? So we sort of look at the world to say whether you're aging or you have like a disability, it's just on a different time scale, right? So if you have a disability, it's like it might happen really quickly. You get in a car accident, it's like you just aged very quickly. Right, and you need things that you might have needed later when you're in your 90s. Um, or if you make it healthy and you make it into like late age, then you're still going to need stuff, right? You're going to need glasses, you're going to need hearing support, you're going to need walking support, you're going to need, there's all this stuff. So in thinking about the scope of BCI, think about it as every human being on the planet would benefit from a neural interface of some type, right? And if you combine a neural interface, whether that's something you wear on your body or it's something you implant into your body, all of them will need to be deeply personalized, right? Because everybody's unique needs, what you want to do with that implant or what you want to do with that neural sensor may be different. And that might change from moment to moment. So different application, right? So you'll need apps that you're going to interact with, whether it's monitoring your health or you're doing something with it, like controlling like a Jedi, controlling something in the room. Um, so everybody could benefit from a neural interface. Now, if we sort of back out of that and say, let's kind of say you've got people that have a diagnosed condition and then you have everyone else
Yeah.
that doesn't yet have a diagnosed condition. It's about 15% of the world. 15 to 20% of the world has a diagnosed condition that would benefit from a BCI today. Now the blocker is that most insurance and like the regulatory side of things hasn't yet sort of zoomed in and expanded kind of the scope of that. So that's the next 10 to 20 years. We're going to see a lot more clearance of FDA cleared devices, a lot more reimbursement schemes that are set up for funding for certain kinds of things regarding neural interfaces within health, right? So there's the healthcare side of things. And then I think there's education. So you're going to see more like research, education, K-12 kind of use cases for mental focus, getting better grades, you know? And then you've got kind of wellness side of things, kind of the quantitative self people who are into like the Fitbits and the Aura rings and the like, they really want to see what's going on with their body so they can make better choice. And so the stuff you just mentioned was more of that latter.
Yeah, exactly.
Like that's like more of like consumers are starting to get introduced to like BCIs for things like mental focus and attention, short attention spans and um, taking breaks or mindfulness or sleeping better, right? So these are kind of soft benefit, right? These are soft benefit, more about getting into a good routine, which is where most of the consumer BCI is today. However, most of the investment, right, like government grants, big venture capital, sovereign wealth funds, hundreds of millions of dollars, billions of dollars are being poured into healthcare use cases, right? And so I would say where most of the money is and where most of the opportunity is over the next, say, 10 to 20 years is going to be in the healthcare space, right? With like legitimate healthcare patients, legitimate healthcare use cases. And that's going to sort of blur between like non-surgical and surgical.
Right. Oh, perfect breakdown. Yeah, I was the reason I was asking that question was for this other question, which you've kind of just answered, and I think it's, I think the general public has become aware of BCI tech mostly because Elon Musk went on Joe Rogan and talked about Neuralink, um, and it kind of entered the public consciousness, if you will. Like I think it was right before COVID. But before then, like I was aware of it because I've been interested in technology and a lot of my people in my network have been aware of it, but we didn't fully understand it, right? So there's this, I guess the question is, as the public consciousness has grown, has the investment, um, has the focus changed? To me, it sounds like not really. It sounds like it's been in the medical healthcare field and it's continuing in there. But that's why I was also asking for this. Is it like 1% into this wellness, mindset changes? And has that changed at all? But it seems like it's still vastly in the healthcare arena.
Yeah, yeah. So this is a good, right? Because I love to sort of span across all these different sort of fronts, and maybe as a result of that, you'll get a bigger sort of picture. But uh, I'd say BCI, without calling it BCI, has been in the public consciousness for decades, but it's been mostly in movies, right? Like sci-fi thrillers, Black Mirror, like lots of kind of dystopian futures or utopian futures where you can sort of zoom through space time or you can imagine things. I mean, Star Wars 1, when like Luke is like pulling like this, the X-Wing out of the swamp. I mean,
Sure.
got telepathy and all this stuff where like every little kid imagine what I could do if I could just think something and it would happen. Right? Like that's been in the zeitgeist for decades, for probably a millennia. Everybody's wanted to do it. But the funny thing is I think, yeah, so public figures like Musk, Elon, he basically just sort of rang the gong and said, it's not sci-fi guys. It's like here. And we're make it now. Right. And so I think what most people didn't understand is that there's been like, since the 50s and 60s, there's been a tremendous amount of research, like grant dollars going into universities, like really, there's really solid science, right? There's really foundational science. There's just been very poor engineering, right?
Oh, okay. Okay. Interesting.
And so mostly it's a matter of like what's going to unlock the real science is going to be really creative engineers, right? That are able to build products that work and are reliable, but have a good user experience that many people want to use, right? I think it's really the user experience piece because there's a lot of there's a lot of startups now that are kind of moving into the BCI space, but they're all still focused on just building sensors, and they're trying to get the noise out of the sensors, and they're trying to get the accuracy right. They're trying to build machine learning and AI algorithms that can classify the right intention and not have like the wrong intention. And so there's just a lot of like brute force kind of engineering capacity being thrown at building sort of the bedrock of the actual commercial BCI industry. But the real missing link for adoption is going to be what can I do with it? What kind of apps? And what's the user experience around that? And can I easily get the technology, right? Like,
Right.
Could I go into a store and buy it? Can I order it online through Amazon? Do I have to get a prescription for this thing? Do I have to have certain, so
Right.
the easier it becomes for people to get the technology, right? The more prolific. Imagine that there's a full like Apple App Store or like a Meta App Store, right? That is like full of apps that like take advantage of neural sensors. That's when it gets really real.
Very interesting. And I guess going back to one of the first points that you made, it's really about having the non-invasive technology that you could put on, and then you don't have to go to some, you know, clinic somewhere and get a chunk of your skull taken out and having a sensor implanted in you. That's that I is pretty dystopian. Yeah, or dystopian. Yeah.
Yeah, absolutely. And there's like amazing stuff that you can do. I think there are, again, everything's on a time horizon, right? So there's like, what can you do with a brain implant or a brain sensor today versus what can you do with it in 5 years versus 10 years versus 20 years? And just you're looking at these convergent trends and saying, well, thinking about compute and just these massive leaps, right? These step ups in compute power, these massive reductions in size in computing and bringing computing out of the data center and putting it into your pocket, right? Like imagine you have like the full compute, like the deep seek stuff that just got announced with China and OpenAI and like how kind of, wow, that just kind of broke the internet, and OpenAI is probably scrambling a bit on like that. But then they doubled down and they said, not only is it cheaper and just as fast, but guess what? It can run on a Raspberry Pi. And you're like, now you're like every tinkerer who loves to just tinker in their like garage could now be running like full ML models and AI on a little chip on something that they could just stick in their pocket or their backpack. That is crazy amazing, right? So think about like all the applications that are going to unlock when you can tie a brain implant to wearable computing that is small and discrete like that.
Mhm.
It's going to be absolutely nuts.
So just to maybe solidify this idea here, because I remember hearing about this from another guest in the past. To me, it sounds like the fidelity that you're getting with an invasive BCI technology right now today is substantially higher than a non-invasive one. But given the exponential growth of technological advancement, I don't know, 2 years, 3 years, 5 years, 10 years, there you might be able to get as much or enough data from our brainwaves from a non-invasive that you'd be getting from an invasive today or in a couple of years, that there might not be a need for any invasive tech anymore because you can get enough data from a non-invasive. Is that correct?
You could hypothesize that in a very real way, right? That non-invasive will cannibalize quite a bit of the invasive market opportunity. If you're thinking about sort of regular use cases, right? Like I want to control my computer. I want to play a game. I want to do some basic like mental state stuff, right? And whatever. And so there's going to be a lot of applications that will be just fine with non-invasive. But there's still going to be a need for implant, right? So if you think about, but it's going to be either like the bar is really high for what that need is, right? And so you might have things like depression. So there's a company called Motif Neuro out of Houston, and they're an upcoming neural implant company, just like Neuralink, except they stimulate the brain. So they have a little thing called the dot, and the dot is like they bore a tiny little hole about the size of a number 2 pencil eraser, like a smaller bore size. And they just go through the skull and then they put this little device in the hole and plug it just like you would a Neuralink. But what it does is it sends an electrical pulse into the brain and you can control it from outside wirelessly. And so it's for people that have severe depression, which is huge, right? There's a huge epidemic for depression, but they can stimulate parts of the brain and help reduce the depression symptoms, right? And in a way that drugs can't do, right? These are people that are just like resistant to the effects of pharmaceuticals. And so you're like, that is a amazing, like you can't do that with non-invasive stuff, right?
Right. Right.
You can't do that level of discrete therapy with non-invasive. If someone wants to like control a full exoskeleton and run in the Paralympic Games alongside people that have like real legs. Like imagine you have somebody standing in the blocks in like 100-yard dash in an exoskeleton.
Right.
You can't do that with non-invasive. You'd have to have a brain implant doing that. So there's some kind of, you can imagine a future where it's like, you know, there's a world where it all coexists, and it really just kind of comes down to what the person wants to do, and if you need real-time bionics that are responsive to like sub like 5 millisecond response times, and then it behaves equally to or faster than it would if you were to use your normal arms or legs. Like that's an
Invasive indeed. Okay. Okay. Well, that's very useful and very clear. Helps me kind of visualize the future, and I'm sure the same for the audience. So why don't we jump into what you guys are doing right now? So non-invasive has augmented reality capabilities as well. What does your and I can see on the poster right behind you, what can you have 3 products, but 2 look like these headsets. What can they do?
Yeah. Well, like the one I holding here, this was the flagship product that we created called the Cognition One. It was our first fully integrated wireless BCI. So you could see sensors in the back pad. Those sensors make contact with the back of the scalp in the back of the head. And it has an augmented reality with an optical see-through visor. So you can actually see through the lens.
Very cool.
So it's bi-directional in the sense that the user can see out, but also people around them can see their face and eyes, right? Real time. So it's just like sunglasses. But it has internal projection of holograms inside, like a heads-up display. And so imagine you've got a full AR headset that can be responsive to your brain waves, as well as head movement, as well as eye tracking. So what we've done is we're not just a BCI company. We've actually built a multimodal, what they call like sensor fusion. So we combine eye tracking, BCI, and head motion, and we can use those things in synchronicity together, like a concert of biometrics kind of working together to adapt the software that's running in the headset to the user.
Very cool.
But for some people that maybe they can't use their eyes or they can't move their head, but they can still focus their mind, they could reduce it down to just the BCI. So the intended design of this was inspired by Stephen Hawking and people with ALS that have a progressive condition. And so the idea here is that you could start at the early part of the disease and say, while you still have head motion, but you might have trouble walking or moving your arms, you could get this headset and just use head pointing. But then as the disease progresses where you can no longer move your neck, then you could switch over to eye tracking. And then when you have trouble with eye tracking or where it becomes too taxing and tiring, you could flip over to BCI. And so this would extend the usefulness and the accessibility of the world for someone that doesn't have any option beyond eye tracking, right? And so that was the intended original purpose of the Cognition One. And so this device received FDA Breakthrough Device designation already. And so we're in the process of working with the FDA and doing clinical trials to validate that it works with people in the most locked in state. So that's this version. So this is intended to be commercially available, covered by insurance. But then what we realized is when we announced this version of the product, we got a lot of inbound requests from health systems, very large health systems that have very large populations of people that have conditions like brain conditions, nervous system conditions. And they're like, could I use that platform? Can I use your hardware platform, but could I develop apps for it for other things? And so some of these health systems, they want to use it for other kinds of prosthetic applications besides speech and wheelchair control, which is what we're doing. They want to use it for like diagnostic. They want to use it for therapeutic. So there's all these applications. So what we did was we created a derivative, but kind of a spin-off version of this product that's more of like an open developer kit.
Gotcha.
So we allow really low-level access to the hardware and the operating system. And we provide all kinds of libraries of software tools and development tools for people who want to build apps that can basically integrate your biometrics into the application. So now we're going to have a bunch of news coming out later this year about some of these health systems and sort of their mind-blowing projects they're doing. So I don't want to sort of steal the thunder of some of those things.
Gotcha.
But they do rate. I mean, what they're doing is they're basically doing clinically validated apps, right? So compared to the stuff you can get in app stores today, which is like, buyer beware. It's like you don't know. It's sort of like if it's been validated or if it works or not. The apps that are being built on this are being run through actual clinical trial, right? And so these are big health systems with big neurology department and funding to basically run all the way through massive, 300 person clinical trials to test and validate the apps that run on our system. And then they'll be making those apps available commercially. So now we're like, wow, we went from a point solution of a wearable communication device that's FDA cleared to now a development platform that's going to unlock like hundreds of use cases across neurology. So that's really what we're doing now. And that latter version, the research version, is currently for sale. So it's in market today, it's available internationally. So, we're like commercially, we're like 5 to 10 years ahead of all the other BCI companies that are in the, invasive.
Right. And that's because you've essentially transformed into a bit of a platform.
That's right.
So interesting. So interesting. I just want to ask you about the tangible cases, but it sounds like that have to bring you back on and near the end of the year for us.
See some of them, but like, some of them are in the realm of like, we have one health system that's pushing in on concussion detection. So most of like concussions are, when they occur, you just go through sort of a physical, like an analog kind of assessment. You're like, look here, talk, and they just kind of do a judgment call and they're like, okay, I'm going to sideline you off the field or whatever, if it's a sports based concussion. So there's specific science around using this kind of technology for very rapid, like sub 1 second measurement and very accurate diagnostics of not just if you have a concussion, but the severity of it. Right. So that's one area that's really super cool. And we're starting to engage with a major sports league to make that kind of technology available and testing it out. And then another example is if you've ever, it's an old movie with like, I think Robin Williams or something, and it was like called The Awakening. And it was dealing with people that, I could be wrong on the title, but it was, it was about people that were comatose. And then all of a sudden they come back to life. It's like you're reemerging out of this like deep sleep. And so we found out that there are 800,000 in the US alone. There's 800,000 people per year that are admitted into the hospital, like emergency room, unconscious, completely unconscious. And so there's a use case where a system like this could be rapidly donned onto someone's headset and assessing their level of consciousness and be able to sort of prescribe the appropriate triaging techniques to more accurately assess the individual, right? And help them claw out of their locked in body state. That's right.
That's amazing. Yeah.
There's others that are doing like human machine integration. So thinking about driving high speed Formula One cars using our system. So there's a bunch of really interesting things that they're not all health, right? But it's around like the HMI, the human machine interface. There's computing, there's assistive tech, there's therapeutics, diagnostics. So it's like there's going to be a bunch of really amazing use cases that are going to be derived from our platform.
Fascinating. To me, this sounds a little bit like the guesswork or the human involvement in diagnosing some of these people or figuring out what the steps are to bring these comatose or unconscious people out of their states. That guesswork or that human interaction is going to be reduced, right? And it's going to become a little bit more obviously machine-like, but it's going to become a little bit more tangible, a little bit more what's the right word here? Like very, very precise in what the problem is. You don't have a doctor that's just doing guesswork. You have immediate understanding, and then the solution can be brought about quite quickly. And I guess if this is done at a large scale, maybe this is why there's so much investment and interest in healthcare, because you can make a lot of lives a lot better, a lot quicker.
Completely. And you can like lower the cost of care.
Yeah.
You can reduce the number of mistakes that are made because of the guessing, right? You can improve the patient experience within the health system. You could probably even drop ship technologies like ours in the future to their home if they live out in the middle of nowhere,
Right.
right? And you can't get someone to drive in 9 hours to get to the closest neurologist, So these are future where, like, imagine a future where a platform like a dozen clinically validated neurology apps with remote telehealth built in, and you could drop ship it to someone in the house, and it's like you're sending an entire hospital to somebody.
Very cool. Yeah.
Right. And that's kind of the beauty in that we're not just a BCI sensor, right? We're actually a platform that includes 5G, Wi-Fi, a heads up display with full, like, high resolution, high color, opaque, holograms. So you could build avatars, you could do video streaming, you can do music, gaming, like all the kind of things that you would dream of doing in augmented reality. We have that. Right. And then, but we get the sort of, but wait, there's more. It's like you get the neural interfacing and it's closed loop. Right. So a lot of folks are trying to get here, but they're building off of off the shelf technology. So there's startup companies that are trying to cobble together solutions by combining like off the shelf EEG headsets with like a Meta Quest headset or a Microsoft HoloLens headset. But it's like those systems are not made to work together, right? And whoever is building a company off of disparate technologies and integrating them, that's a very fragile business model, right? Because if one of those product companies changes their strategy or end of life that hardware system, then you're kind of hosed. And I think this is where it comes into play. A lot of FDA cleared augmented and virtual reality systems today are based on the Microsoft HoloLens.
Okay.
And they EOL'd the HoloLens, the end of life.
Right. Right.
So what are these companies gonna do? Right. Yeah. So, and the HoloLens was never actually medical grade, so it's like, I'd say there's a bunch of convergent things that are happening that are tailwinds for our company, right? And so by focusing on healthcare and these kinds of use cases, we think there's a massive abundant market that we can address and help a lot of people.
Yeah, it certainly sounds like I'll have to pay attention to those updates that come out. You said near the end of the year, right?
No, throughout the
Throughout the year.
a bunch of updates coming out in the first and second quarter. Yeah.
Cool. Yeah, very exciting. There's not too much time left here, and you have such great long answers here, Andreas. Should we touch very briefly on like privacy and data issues? Because I know that this comes up in pretty much every single conversation that I have with guests. Now you were talking about your system is a closed loop, but I think that there's pretty much everybody that's listening to this podcast is concerned about AI on their phone stealing all their data and shipping it off to the tech giants and selling them all sorts of stuff that they might not want. How have you guys dealt with privacy and data security, especially if your headset is able to take in significantly more data than say like my smartphone sitting here on my desk?
Yeah, I'd say, the current state. So we have two different sort of data strategies, one for like the first version of our device versus the research version. So if you're going to have a device that's yours, it's prescribed to you, it's yours, it's all your health data living on it. The strategy is really that data lives on device. It lives in a private HIPAA compliant cloud that is owned and administered by yourself. It's your data. And that you have choices to integrate or syndicate that data out, right? So if you want to share like your data with a health kit or with some other kind of, if you want to share it with like your health records or with your doctor, that's up to you, right? Because that is your device. On the research side, we actually don't we don't currently store the data. Like because the devices are sold to the health systems and health systems and the universities are doing their own research. that they're responsible for the data and privacy. We're just providing them the tools.
Gotcha.
And the access to secure networks and the ability to do things kind of in a confidential private cloud way to be able to do data and integration. So we provide them the systems, but the actual compliance of where the data lives and that's under, they call it IRB, it's Institutional Review Board, and a healthcare IT standard. Trust hospital, then you should trust the system. Trust hospital, then
Yeah, you might have bigger issues.
right.
I have to, and I certainly want to focus a little bit more. We already touched on it a little bit, but like the next, say, 5 or 10 years, right? So you touched on a little bit outside of the healthcare industry where these and BCI in general, not just you, is starting to enter into different industries. Do you see this technology becoming ubiquitous in like 10 years, like smartphones? Or is it going to take a little bit longer? And like, is there going to be some sort of network effect where people start using it, they like it, they get their friends on it, and then if you're not using it, then you're behind because it gives you, I don't know, superpowers for lack of a better term here. Like, what's the roadmap, if you will, for adoption?
Yeah, I'd say, the mass scale, when you think about consumer BCI, is still going to be around content, right? It's going to be around content. It's going to be around gaming. It's going to be around like experiences. There's going to be control interface stuff, but you're going to see a variety of use cases that are going to be like the big markets open up, I think, with a couple of things. One is that BCI and neural interface, the user experience around it is good and fast and smooth. We sort of call it like buttery smooth, right? It's like just feels wonderful, right? It's like it's consistent, reliable. I'm trying to say like I'm playing Fortnite and I want to use my hands on my controller, but there's something I want to do with my mind that's kind of an extra capability, right? What is that? And does it reliably do that very, very quickly every single time, just as equal to the performance of like my hand controller? So I'd say when BCI becomes that good, that fast, and that sort of seamless into the user experience of like gaming or other kinds of real time things, that's when sort of the whole thing opens up, right? Um, and then second to that, I would say what might precede that is authentication, right? So I think authentication kind of precede that. So the ability to um, like you can do like Touch ID or Face ID on your phone or biometrics around your eyes, right, and face. So like the iPhone started with touch and then it went to your face, and then you do the Vision Pro and now it's doing ocular eye, pupillometry.
Yeah.
Then that's all superficial, right? It's like it's your skin, it's your face, it's all camera based. So ultimately BCI is kind of like the ultimate like 5-factor authenticator, right? Because it's like there's no way to sort of clone what's going on from the back of your retina to the back of your head, right? Uh, Only we would see that. So we being like whoever's at the BCI, right? But what you're also going to see, and sorry, I'm going a little bit long here, but um, it's not just there's going to be different kinds of quote unquote BCI, right? Or things that sort of listen to your nervous system. So Meta just announced they have like the Orion glasses. They actually resemble real glasses. They're kind of chunky, kind of look like cartoon glasses, but they're pretty cool. And they just announced the release of it with an EMG armband, so like a wristband that measures your muscle movement. And so they've been working for years to try and like replicate your hand movement, like your finger movement in virtual space based on your wrist. So to try and so that you could basically have your hands in your pocket, or that there's no camera that could see your hands and you could still control virtual hands in like VR. So that's happening now, right? Whether it's just tapping something or actually typing out a keyboard with your hands in your pockets, right? So that's EMG. It's not really BCI, but it it's impulse based. You're seeing earbuds, right? In-ear earbuds and also over-the-ear headphones that are using EEG, right? Technology. So over-the-ear headphones It's kind of coarse. There's a company called Neurable. They do some pretty cool stuff. They just launched a version at CES, I think, that's now publicly available. And they're monitoring mental focus, right? And so you could say that's a BCI. But it's a really small use case, right? It's like a big send me an alert, if I'm focused or not. The in-ear stuff gets really interesting because you could get into like more rich data around what's going on in the brain and in the ear and intention and so on. And then what we're doing, which is actually on the skin, on the skull. So we're on the visual cortex. So if you think about BCI as a way of measuring what's occurring actually in the nervous system and the brain, and most BCI companies are going to kind of want to own a sense. They're going to want to own like the visual sense, the audiology sense, the hearing, like what happens in the ear, the mouth, right? So there's folks that are building sensors for inside the mouth, right? So like imagine a retainer with a touch screen or a touch that you can like move your tongue around. There's a company called Augmented. They're doing these cool like retainer looking touch screen for people who can use their tongue to move a cursor around. So the future is going to look like a bunch of what's called NUI, natural user interface. So we're going to be moving slowly but steadily towards like computing that no longer needs a mouse or keyboard. Like the mouse and keyboard are going to die. But the problem is that we've become so used to how fast we can do things with a mouse and keyboard that widespread expectation is that if you're going to take my mouse away, then whatever you're replacing it with needs to be just as good. If you're going to take my keyboard away, then whatever my data entry is or whatever my interface is for like inputting text or needs to be just as good and just as fast. Those are going to be the adoption limiter, right? Is to say you're going to swap out the mouse, you're going to swap out the keyboard, and you're going to end up immersing people into either 2D experiences or 3D immersive experiences.
Fascinating. Final question here. With that in mind, how does, society or maybe even like human interaction change? Is it we're talking on a couple computers here. Are we going to just go to the park and have these podcasts? Are we going to be just freed up from our desks a little bit more? Or is there going to be some other kind of, maybe larger scale impact that is going to change the interaction that we have, like business interaction, human, out of business interaction? What's your sense on that?
I sort of think about it in nouns, right? And so the way if you say like, we're going to interact with things, right? And you're going to use your brain as a method for interacting with things, right? Then it's like, well, what are you going to interact with, right? You're going to interact with people. You're going to interact with places or the built environment. You're going to interact with smart objects or things or robots that have some level of intelligence. You're going to interact with content or other agents that are kind of virtual or, synthetic altogether, that are like virtual bots, virtual intelligent AI agents. So there's probably like a handful of things that we're going to be interacting with. And so having an interaction paradigm that says, when I'm interacting with smart home and like a bunch of like IoT devices in my room or in my house, what's my interface? Do I think about the temperature and then all of a sudden a user interface pops up in my glasses that's like my thermostat, and then I can say warmer or colder with my mind and just adjust the thermostat? Or do I not even need to think about it at all? Like I just set it and forget it, and I set some preferences, and the sensors in or on my body basically say, oh, it's broken a threshold. So it knows that my body runs hot or my body runs cold, and I like it a particular way. And it knows that I'm in the room, and then it adjusts itself because of my biometric, right? So you could see this, like, you could have an intentional, like, I want to interact with the IoT system like a thermostat, or the thermostat could actually be talking to my body and my biometrics.
Right. And it could know what is the ideal state for a flow state, or like you're at rest. Like I just fractured my foot a couple weeks ago. Like what's the ideal temperature to help heal my foot or whatever, right? I don't want to think about that. I just want it.
Yeah, yeah. And you could do the same thing in the shower. You could do the same thing with like your brushing routine, like brushing your teeth. You could be doing the same thing if you're going to the bathroom or whatever. You're doing the same thing when you're like on a walk, and it's like it's encouraging you to like increase your gait because you're just like shuffling your feet, and you're like you need to take bigger steps to get them. It knows that it knows that normally when you get off the bus to like the front door of your office, you're like 1,000 steps or something, and you're kind of like, oh, the past 2 weeks you've been doing it in 2,000 steps, which means you're shuffling. Like you need to take bigger steps to get your cardio and all this. Like imagine that it's like you're taking the decision making out of quantitative self, and the system could actually naturally be like your big mother, right? It's like looking after you, because we don't always make good choices.
Yeah. Oh, I think we very often don't make good. I mean, speaking of somebody who fractured his foot like 2 weeks ago, I think we don't make choices.
Right. So this is kind of where that's on the longer horizon, right? Or you're the examples of these things popping up over the coming years, where you're like, wow, as a proof of concept, that university working with that technology, demonstrating that application shows a lot of promise, And so we think that, going back to what we're doing, we think that those organizations that are going to be doing these amazing sort of mind-bending futuristic proof of concepts are going to be building it on the cognition platform. And at some point, cognition is going to be like a feeder for investors, right? Investors aren't just going to want to invest in cognition. They're going to want to invest in the apps that are derived from cognition's platform, right? As an accelerator. So we really sort of see the future as like being very abundant, and it becomes kind of this virtuous circle, right? By focusing on a positive human experience that enables people to make more independent choices and own their data, and that AI can step in and help you make good choices, or just take over some of your choices if you're not good at making those choices, right? To live a better, healthier life. And so this is kind of the things that I think we're going to start to see, but it's going to really require an ecosystem, because there's not a single company that can do all that.
Sure.
Right.
Yeah. And we're starting to see that ecosystem being built, and that future, as you said, there's like hints or glimpses of it starting to materialize.
Yeah.
Fascinating. Andreas, our time is up here. I feel like I'll have to have you back on at some point if you're doing another podcast round. This is fascinating stuff, and it reminds me of why this technology is one of the coolest to talk about and most interesting to bring onto the podcast. So thank you so much for your time today. I'm going to have to go and think about this a little bit more.
What feels better?
Yeah, well, I need some sort of BCI tech to help me heal it properly. Very cool. I'll have your website. I'll have your LinkedIn up on the show notes. Are there other places where myself and audience members can follow and definitely hear some of these news events that you'll be putting out over the next couple months?
Yeah, I would just say follow us on LinkedIn. Follow us on follow me personally on LinkedIn, and just visit our website. If you have interest in early access to some of the technology, our systems are now scaling out internationally. So yeah, depending on sort of where your audience is, if you're interested in developing novel applications that bring sort of neural data in the loop, and you want to sort of make technology more invisible and really explore what's possible as like new natural user interfaces, let us know. We'd love to help you out.
Perfect. Well, thank you so much for your time. It was very interesting, very enjoyable, and certainly brings my my foresight, my strategic foresight senses back in. So thanks again for your time.
My pleasure, Mark. Okay.
Take care.
Take care.
Well, thanks for listening to this week's Future Tech and Foresight podcast. If you like what you've heard here, there are, of course, a number of ways that you can support the podcast. The best way would be to leave a review on Apple Podcasts or give a rating on Spotify, which you can find a step-by-step explanation for on the futuretechandforesight.com website. Alternatively, feel free to leave a comment either on the episode show notes
or the YouTube channel where you can see video recordings of the interviews. And finally, if you are part of an organization that is aware of the disruptive and transformational impact that emerging and future technologies will bring and want to know more, please get in touch to hear about the strategic foresight services that we offer and how we can help future-proof your organization and take advantage of the phenomenal opportunities available to survive and thrive in the future.
A lot of future-shocked people and future-shocked institutions in our society are simply overwhelmed.
Once there is superintelligence, the fate of humanity may depend on what the superintelligence does.
Science fact is catching up to science fiction.
The first truly intelligent machine will be the last invention that humanity needs to make.
The only scarcity that will exist in the future is that which we decide to create ourselves as humans.
Within a 10-year design revolution, we can have all humanity living the highest standard of living anybody's ever known.
Progress is accelerating at an exponential pace, and it's going to reach a point where progress is so fast it's going to be a singularity.
We are probably one of the last generations of Homo sapiens.
Every single headline points to the birth pangs of a Type 1 civilization.